Olá, como vai? Um prazer estar aqui com você. Sou Leonardo Giusti, sócio de Infraestrutura, Governo e Saúde da KPMG no Brasil. Hoje aqui comigo, Ana Van Polk, nossa Global Head de Saúde. Vamos falar sobre a Aliança para a Sustentabilidade e Resiliência do Sistema de Saúde. Uma aliança global que a KPMG teve o prazer e a honra de participar e de assinar, proveniente do World Economic Forum para Healthcare, com outros participantes, AstraZeneca e Philips, e aqui no Brasil, a condução do projeto sob responsabilidade da Fundação Getúlio Vargas. Vamos passar por um bate-papo interessante sobre o programa, a visão da Ana, que é a nossa embaixadora da KPMG para essa aliança. Ana, thank you for being with us today to talk about PHSSR. So to begin with, tell us about the initiative. What is that for? What we are pursuing, and what make us to join the alliance, and your perspective on that.
Yeah, let me start with saying what PHSSR stands for. It's the Partnership Program for Healthcare Systems Sustainability and Resilience. And in short, I think what we saw globally, and we discussed it at the World Economic Forum in Davos a couple of years ago, is that we saw during COVID-19 that healthcare systems were not very resilient to crisis, found it very hard to step up. But also what we're seeing more as an underlying threat is that they're no longer long-term sustainable. And actually we see that all over the world post-COVID. We see shortages in workforce, we see very long waiting lists, we see rising costs, and actually we see a lot of problems in the rising demand and the shortage in supply. So the World Economic Forum started a program together with AstraZeneca and then Philips on researching the sustainability and the resilience of healthcare systems worldwide. London School of Economics, a very renowned institution, is doing that. They approached us and we were very positive about joining, and that positivity has a number of reasons. First of all, as KPMG, we do a lot of work in advising our clients on the sustainability and the resilience of our systems. I think it's very important that we base that advice in very robust research. Well, with London School of Economics on board, you can rely on being very robust research. Secondly, it's a global program, and we in KPMG in healthcare, we're a global firm. We're working with 5,000 people in 70 countries. So I think it's really very worthwhile that we have insights from across the globe what makes sustainability and what makes resilience, and what are the threats and what are the recommendations for the future. So that global mindset was the second one. And the third one, I mean, we work in healthcare, and my 5,000 colleagues, I always make the joke, what does it get out of our bed in the morning? We get out of our bed because we really want to improve and strengthen health and healthcare. And I think participating in a program like that is really paying tribute to that wish, to that ambition to strengthen health and healthcare systems. And that's why we think it's really important to do it in that perspective.
Very, very nice. And what are the key central insights or key insights from the study, and how we can connect what we've been learning from this alliance to our healthcare horizon, for example?
Yeah, so we've done I think we've done 20 countries now, ranging from Japan to countries like Poland, the Netherlands, Belgium, Brazil. We're very proud of that. We've done Canada, we're working on Saudi Arabia, so 20 countries across the world. That's a very large group, a very robust database. I think to generalize and to summarize, the key findings can be divided in 4 areas. It's the area of integration, it's the area of evidence-based working, it's the area of workforce, and it's the area of inequalities. So just a few findings from the study, and this is going to be the sort of, the lacking points, and then of course we get to recommendations. So in integration, what we see that there's all across the world, there's a lack of coordination between GP, primary care, secondary, tertiary care, also lacks of coordination sometimes between regions and countries. In general, we are underfunding primary care, so that's underfunded, and we have very strong hospital-centered systems. And the third point is that funding does not really always encourage collaboration and integration. So that's on integration. On workforce, what we see is there's a huge lack of workforce. That's a worldwide issue. But what we see moreover is that there's huge variabilities in the availability of workforce. You can see that in Brazil, by the way, the rural areas and the impoverished areas versus the richer urban areas. There is a very much an issue in the well-being of our workforce. And what we're lacking in general is longer-term strategic plans to tell it that with all the technologies and digitals, what is the workforce of the future in terms of qualities, in terms of quantities. Then the evidence-based working, what we see is there's a huge variation in the availability of data. There is a lack of interoperability in data, and we are lacking a lot of data on the environmental impact of healthcare. And then the last one, inequalities, is really about, do we have enough data worldwide to understand populations and their needs? The second part is, do we have the right population health data to make the right interventions? And the last one is, do we have the right data to put the right workforce in the right place? So these are 4 fields. And the 4 fields are actually what we're finding in general. There are, of course, differences between the systems worldwide, but a lot of the findings are comparable, and they're also comparable to Brazil. So Brazil has a strong primary healthcare system, so that's a very good point. But Brazil has a lot of digital and electronic health records, but the issue of interoperability, the lack of interoperability is the same. In general, you have a strong primary healthcare system, but it's still very much hospital-centric. Reimbursement is very much focused on curation rather than on prevention. What we see as well is that there's an unequal distribution of workforce. Brazil suffers enormously from the fact that you have a lot of workforce in the rural and the underprivileged areas. So what we see is that a lot of the findings that we find globally are also applicable to Brazil.
Very, very interesting. And one thing that I want to hear from you about is from the results already achieved in the various countries that published the studies. What is possible to disagree or argue about resilience and sustainability?
Well, I think actually, so what is possible to agree? I think actually we have worldwide, we have the same challenges. So I think what we can totally agree on that putting more money towards healthcare is not going to solve the problem. What we can all agree on that getting workforce from countries that are less developed is not going to solve the problem. What we can all agree on that if we keep on having very fragmented systems, we're not going to solve the problem. And what we can say that if we don't have a new thinking about reimbursement, we're not going to solve the problem. So I think there's a lot of agreement. I think the disagreement, I wouldn't call it disagreement, but I think the disagreement is about where are the major problems and what do we need to change towards the future. That's very much in line with what I was saying. So that's all about creating operable data systems, planning workforce for the future, thinking much more about integrated ecosystems to deliver care, using digital to deliver care, and work much more on a population health based and use much more data and databases and information about populations to work on prevention rather than on curation.
Nice. And tell me about what you consider the most feasible, achievable in the short term, and what is the most relevant discovery that can change the system in the near future?
Yeah, that will vary a little bit per system. I think one of the findings that sort of, goes throughout is that for the sustainability of healthcare system, strengthening primary care and integrating primary care and community care is going to be at the core of every system. That's going to be a pretty achievable one. I mean, we're not achieving it tomorrow, but most countries are already building their primary healthcare systems. So I think that's a very achievable one. I think a more longer term one, which will take more effort, is actually is that whole digitization of healthcare. And that digitization of healthcare has different aspects. It's collecting data, using data to get insights into population, using data into what works in terms of intervention, using data to work on prevention, but also using technology to get towards a new delivery system in healthcare. So using the Internet of Things to deliver healthcare directly to patients, using the Internet of Things to improve delivery of care in remote areas, using digital to support workforce. I think the use of technology, if we use it in the right way, is going to have the biggest effect on healthcare, but it's also a path that we need to follow very carefully. A lot is possible already with ChatGPT, with generative AI, but we need to work on things like trust, regulation, making it available, preventing that digitization of healthcare is going to lead to larger inequalities rather than larger equalities, compliance, regulation. So tech is going to be very big, but it needs to be threaded very carefully.
Interesting. Now, coming to Brazil and having the report released, considering our healthcare system configuration, public, private, and also taking into consideration the aging population, so we are getting older, increase of chronic diseases, and lack of a sizable number of health professionals. So what are our threats and opportunities? How we can take advantage of this study and work in a sense of improving our health system? Yeah.
I will treat it in the same way because the threats needs to be turned into opportunities. So I think that's a very good point. But I think reflecting to what you're saying, I think one of the strong points of the Brazilian healthcare system, that comes very clear from the results, is your very strong primary healthcare system with the family health team. That's a real strong asset. However, if you want to turn it into an opportunity, you need to make that even stronger. And secondly, and that's a threat and then again an opportunity, yes, you have a very strong primary care system, but the integration between primary care and what happens in the hospital, your ecosystem, it's still very fragmented. And so what needs to be happened, keep working on that primary healthcare system, but start working on integrated care pathways. A threat to your system is that your system of reimbursement is fee for service, is very much focused on curation, not on prevention, and is very much focused on having a higher production rather than working on keeping the population healthy. So you need to transform your fee-for-service system into much more capitated fee population health systems. A lot of EHRs, a very strong setting for life sciences and medtech, which is great. At the same time, low interoperability of data. So a lot of EHRs, but they're not communicating. So keep going on that digitization, medtech on your EHR, but start working on the interoperability of the data. And a second step there is start using that data to start working on things like population health. So knowing where are risky populations, where do we need to start intervening. Those are very important. Workforce, especially a shortage of doctors. And what we see as a threat in the study is a very unequal distribution of doctors. So more doctors in the urban areas, in the richer areas, less healthcare workers and doctors in the rural and the underserved areas. So that's something that needs to be worked on. So Brazil needs much more of a long-term strategic planning. Very good point is the education. So training more people. Risk is the quality of the education. So can you use technology there to do much more remote training of people, but being sort of coordinated from a strong center? And then I think one point is that in Brazil you have a public system and a private system, and they're very separated. And the funding needs to benefit the private system more. And I think there's two things there. I think public and private need to start working, and that's what we find in the study. That's one of the recommendations. There needs to be a stronger collaboration between public and private, filling in capacity gaps, learning from each other, using innovation. And the reimbursement system needs to work much more towards an equal distribution of funding to the SOS-based providers and the private providers. And it's, once again, not based on curation, but based on prevention. So these are some of the threats, but also how to turn them into opportunities.
Yeah, very interesting, because the study was delivered to the Brazilian government. But of course, our system, healthcare system, is made by public and private, as you mentioned. So we have the universal coverage for healthcare in our constitution. So all 220 million Brazilians have right to have access. On the other side, we have one of the largest private healthcare systems in the world, with more than 45 million clients under the supplemental system. So there are lots of challenges considering payer, provider, and the life science industry. Making all the key players working together with the same incentives, with the patient on center of the decisions, etc., is a big challenge. So what are your feelings and tips for making happen, for aligning the interests of all the key stakeholders in our ecosystem?
Yeah, I think there's an important role for both for government, but also for the private sector. And here I remember one thing, that when I was in my first meeting at Davos in the World Economic Forum, that was during COVID, so it was all online, which was a little bit of a disappointment, but I've been there afterwards. And I remember the CEO of Deutsche Post, who has a very important role in logistics and transportation around the world. And what he said really, it really stood out for me. It was about vaccinations. And he said it very clearly. We, as corporates, need to take the responsibility to have everybody in this world vaccinated, because no one is safe till we're all safe. And I think that statement bridges the gap to what we sometimes see as a gap, that public stands on the one side and private stands on the other side. That's not true. If we think about health as health is wealth, and a healthy population is a wealthy population, that means that having a healthy population is going to support corporates and the private sector enormously. So instead of seeing it as two separate pillars, we need to see that healthcare and the healthcare system as a collective responsibility, working together with collective goals, government and the private sector coming together and working together on what are our goals and what are we going to do, working under one umbrella, and then trying to link the system. So interoperability of data between public providers and private providers. Life sciences industry using data, lots of data that you have in the public system to develop and innovate. Private providers working with innovations, also making them available to the public system. Private providers being the capacity for the backlog in the public system, so you have more production here, but also maybe more efficient. Public system learning from the efficiency in the private system. So I think that we shouldn't be seeing as 2 or 3 separate pillars. You need to be working towards that same target, towards that same goal, and you need to recognize that everybody has his own role in that, but you need to bring it together. And I would say for Brazil, because you've got a very strong medtech industry and a very strong pharmaceutical industry, benefit from that. Set it to use to Brazil. Make Brazil that innovative healthcare nation. I think there's a beautiful challenge here and a beautiful opportunity.
Yeah, definitely. There are many challenges and as you said, opportunities at the same time. So just to finish, what are your hopes? So what are your key objectives for this alliance, for this partnership? And what you would like to see as actual deliverable to our society, not only in Brazil but worldwide, from this initiative?
Yeah, so we just had a couple of very strategic discussions within the initiatives. It's beautiful that we did the research in 20 countries. Now, the very fundamental question for us at this moment is, are we going to do more countries? but then we're going to have comparable findings, very useful for the countries, but where is it going to bring us? So we are now actually starting a phase 2 where we say, well, it's not only about doing, captivating findings and summarizing findings and bringing that to governments or bringing that to stakeholders in the healthcare system. It needs to be about transformation. So what we're doing now, we're going to do, first of all, we're going to do transformation deep dives. So dive into something like non-communicable diseases and what are best practices and what can countries do to improve that. And what we also want to do, and that's also a second phase that we're going to do, the countries that we assessed in the first phase are going to be, have a quick scan and reassessment to tell how much are you improving. And that's what we're going to use to help countries improve. The goal is not to do the research and say, well, this is your photo of the system. We want it to be a movie. So it's not only about concluding, but it's also about activating and using best examples worldwide to accelerate. So it's going to be acknowledging, activating, accelerating, and we're getting into these second phases now. And I think our aim as KPMG is, and that's once again what I said in the beginning, that's why we, our 5,000 healthcare staff members in healthcare, get out of their bed every morning. We want to improve health and healthcare systems. That's why we're in the program, and that's our influence in the program, to push the program towards activation and acceleration.
Well, awesome. And this is a journey with snapshots.
Yes.
So where we are now, but where we're going to be in the future. Yeah. Very, very nice.
Yeah, and that's the conversation we want to have with the Brazilian stakeholders. How can we use this study to help you to accelerate and improve your healthcare system?
Excellent, excellent. Anna, thank you very much for being with me today with this conversation, and thank you for making us participating on this initiative. I'm very proud of what I've been doing around the world and here in Brazil as a leader for health in Brazil, being able to work with you, the international team for healthcare, and our partners here. I'm very proud of this initiative, and I think we are delivering a very robust study to our society. Thank you very much, Ana.
With pleasure.
Bem, finalizamos aqui o bate-papo com a Ana sobre a nossa aliança global para o programa de resiliência e sustentabilidade na saúde. Espero que vocês tenham gostado e até a próxima oportunidade. Muito obrigado.